So we do have some good news to share finally. As I mentioned in my previous update, the federal government has entered into agreements with several vaccine manufacturers. As you may have read in the news, on December the 9th, Health Canada announced that the Pfizer COVID-19 vaccine met the safety, efficacy, and quality requirements for use in Canada. This vaccine will be given in 2 doses spaced out by 3 weeks. The Pfizer vaccine has specialized handling requirements, and we expect this will limit distribution of this vaccine. As other vaccine candidates move through the approval process, it is hoped that vaccines will be available more broadly during the second phase of rollout starting in April 2021. Next slide, please. This slide outlines the 7 leading vaccine candidates. Most require multiple doses at different intervals. To date, Health Canada has received submissions for authorization for 4 vaccine candidates. Next slide, please. The province of Ontario's COVID-19 Vaccine Distribution Task Force developed a 3-part vaccination rollout plan. The task force has prioritized the following groups to receive the vaccine first: residents, employees, and essential caregivers of congregate settings providing care for seniors, healthcare workers, adults in Indigenous communities, and adult recipients of chronic home healthcare. The province will also prioritize rollout to regions with the highest rates of infection, including those in red control and gray lockdown zones. Next slide, please. This slide provides an overview of the 3 phases of the provincial vaccine distribution implementation plan. Phase 1 is estimated to provide over 2 million doses of the vaccines to priority groups in 2 pilot sites, followed by an expansion to approximately 21 hospitals across the province. As the stock of vaccine increases, Phase 2 of the plan will expand to other priority groups such as home care patients with chronic conditions and include an expansion in vaccination sites. Phase 3 will see the vaccine widely distributed to all Ontarians. My next slide will provide some more details on Phase 1. So we'll go on to that slide. Phase 1 of the distribution plan, which begins now, will see over 2,500 healthcare workers from long-term care homes and hospitals vaccinated at 2 pilot sites, the University Health Network and the Ottawa General Hospital. A further 90,000 doses of the Pfizer vaccine are expected between December and January 2021 in 14 selected hospitals in the gray lockdown and red control zones. Recipients will be healthcare workers in long-term care, retirement homes, hospitals, and congregate settings caring for seniors. Pending Health Canada approval, Ontario expects 35,000 to 85,000 doses of the Moderna vaccine in December to January 2021. Recipients will be residents in long-term care homes, retirement homes, hospitals, and congregate settings caring for seniors in gray lockdown areas. In early 2021, provision of the Pfizer vaccine will expand and be provided to up to 21 hospital sites. Recipients will be healthcare workers, and once forward movement is authorized by Pfizer, long-term care and retirement home residents. As well, the Moderna vaccine provision sites will be expanded. Recipients will be long-term care homes, retirement homes, public health units, other congregate care settings, and remote Indigenous communities. Next slide, please. In Halton, a corporate COVID-19 vaccine task force is being established with Dr. Joanna Oda, our Associate Medical Officer of Health, and Tony Oliveri, Acting Commissioner of the Strategic Transformation Group at the region, as co-chairs. The task force will plan, implement, and monitor the delivery of immunization to Halton residents. I will update you on the precise role of Halton Region in the vaccine process as more details become available at the provincial and federal levels. While this is exciting news, even after receiving the vaccine, individuals will still need to follow public health guidance. For example, wearing a mask and maintaining physical distancing. At this time, there is insufficient evidence on the effectiveness of the vaccine to prevent asymptomatic infection and therefore reduce transmission of the virus. It is important to remember that our collective efforts remain critical at this time and throughout 2021, and we should not let our guards down. We must continue to follow public health measures, including staying home except for essential purposes, such as going to work or school, limiting close contact to those that live with you, and maintain a 2-meter distance from anyone outside your household, wearing a mask when with others outside of your household, especially indoors, avoiding all social gatherings such as play dates, birthday parties, and dinner parties with friends or family. This includes any holiday celebrations.